Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
All are true question. All are true about beta blockers except. So option 1, atenolol is longer acting than metoprolol. Yes, atenolol is longer acting than metoprolol. Then labetalol. Labetalol has both alpha and beta blocking action. True, labetalol has both alpha and beta blocking action. 3. Nadolol is long half-life, has longest half-life. True, nadolol has longest half-life, whereas sotalol has shortest half-life. Fourth, carvedilol has alpha agonistic and beta 1 blocking action. So carvedilol actually has beta blocking action. It is carvedilol is a cardio-selective beta blocker. So it is not beta 1 blocking action. It is not selective beta 1 blocking action. Then question. All of the following are actions of epinephrine on beta blockers except. All of the following are actions of epinephrine on beta receptors. Epinephrine activates the beta receptors. So whenever it activates beta 1, it increases the heart rate because beta 1 acts on heart. It increases the cardiac output, increases the systolic blood pressure, and it will result in ventricular arrhythmias. It does not produce AV block because it is increasing everything. So it does not produce AV block. Question. Differences between selective alpha 1 blocker with non-selective alpha 2 blocker is selective alpha blocker causes less reflex tachycardia when compared to non-selective alpha blocker, which shows more reflex tachycardia is seen more in non-selective beta alpha blockers, whereas in selective alpha 1 blocker will result in less reflex tachycardia. Question. Alpha adrenoceptive agonists, that is alpha agonist among the following is clonidine is an alpha 2 agonist, guanabenzine and guanfacine are alpha 2 agonist. Guanabenzine and guanfacine is an alpha 2 agonist, whereas we have guanethidine. Guanethidine is not an alpha 2 agonist, it is actually a ganglionic blocker. Then question. Dopamine, epinephrine and histamine. These are important neurotransmitters. When these ligands interact with their cellular receptors, they elicit response by. They interact with the cellular receptors and they will produce secondary messengers mainly by the G protein coupled receptors. Question. Patient presents with food poisoning. First patients present with food poisoning, and this food poisoning is due to the botulinum. Now, which of the following is correct mechanism? So, botulinum will block the release of acetylcholine from the presynaptic terminal to the synapse. So, this will cause the complete failure of all cholinergic neurotransmission is blocked by the botulinum. Question. A patient presents with severe hypotension and then the underlying cause of pheochromocytoma was not looked for and nor it is detected in the workshop. An oral antihypertensive drug is prescribed. The patient has prescribed antihypertensive drug. We soon find that the BP has gone up to a level above the pre-treatment levels. Which of the following is most likely administered? The pheochromocytoma is not checked. So in this patient, the patient has severe hypotension and severe hypertension, sorry, the patient has severe hypertension, so we have checked every cause, but not the pheochromocytoma is not checked or considered, and they have started with antihypertensive and the BP increased. Actually, whenever there is pheochromocytoma, first we should administer alpha blocker followed by beta blocker, but by mistake if you have administered beta blocker 1, this will increase the blood pressure more, because whenever beta blocker is administered, it will block the beta receptors, but the alpha receptors are not blocked. So the remaining epinephrine or catecholamines which are present, they go and they completely activate all the alpha receptors. Thus alpha receptors causes vasoconstriction, which will increase the blood pressure. So always, if pheochromocytoma should be considered, and if it is considered, you should not start beta blockers first, you should start alpha blockers first followed by beta blockers.
Thank you and thank you for watching.